Okay, let's talk about something that affects millions of us, but is often discussed in whispers, if it's discussed at all: urinary health. Today, we're going to change that. We are pulling back the curtain on two of the most common issues out there, incontinence and UTIs, to give you the clear, straightforward information you need. So let's start with a condition that is way more common than you probably think.
Right. We're diving straight into urinary incontinence, and I'm telling you, the sheer scope of this is probably going to surprise you. Just how widespread is it, really? So get a load of this number. Over 60%. That's right. A majority of women in the United States deal with some form of incontinence. This isn't some rare condition affecting just a handful of people. It's a major health issue for a huge part of the population, and yet we almost never talk about it openly. Now, what's so important about this is the powerful myth it completely busts. For way too long, people have just accepted incontinence as an unavoidable part of getting older or having kids. But the science is clear. It's not. It is a medical condition. And because of that stigma, it's one that far, far too many people suffer through in complete silence. So, what are we actually talking about here? Well, the clinical definition is pretty precise. It's an involuntary loss of urine that's bad enough to mess with your life. You know, this isn't just a tiny inconvenience. It can have a huge impact on your social life and personal hygiene.
But to really get a handle on it, you need to know that incontinence isn't just one single thing. It's actually more of an umbrella term for a few different types, and each one has its own cause and its own symptoms. And this table here lays them out perfectly. So first, you've got stress incontinence. This is the most common one, where physical pressure, like a cough, a sneeze, even a laugh, causes a leak. Then there's urge incontinence, sometimes called overactive bladder. That's that sudden, overwhelming, gotta go right now feeling. Overflow incontinence is a bit different. That's when the bladder doesn't empty all the way, which leads to a constant dribble. And finally, there's functional incontinence, where your urinary system is totally fine, but other problems, like mobility issues, keep you from getting to the bathroom in time. So the big takeaway here is that figuring out the type of incontinence is your first step toward managing it. And believe me, there are some really effective ways to regain control. Let's look at one of the most powerful strategies that doesn't involve surgery at all.
Pelvic muscle exercises, which you've probably heard of as Kegels, are a total game changer. It's all about strengthening the muscles that support your bladder. So step one is just finding the right ones. They're the exact same muscles you'd use to stop your stream of urine. Once you know what that feels like, you move to step two, these slow 10-second squeezes. Then step three is a set of quick, rapid-fire ones. But the real key? It's consistency. You want to aim for 3 sets of 15 throughout the day. It can take a few weeks to really notice a difference, but it is incredibly effective. But, it's not always just about muscle strength. A lot of other things can create major roadblocks. Certain medications like diuretics or sedatives, chronic diseases that mess with your mobility or nerve function, and even depression can all play a role or make things worse. It's a really complex issue, and you have to look at the whole picture. Okay, let's pivot for a second. We've talked a lot about control, but what about when urination itself is just painful? This brings us to the second major topic we're going to cover. That burning sensation, it's the classic sign of cystitis, which most of us just call a urinary tract infection, or a UTI. And these are one of the most common infections out there, period. They send millions of people to the doctor every single year. So what is it exactly? Well, cystitis is just an inflammation of the bladder, and it's usually caused by bacteria. The classic signs are this trifecta of misery: frequency, where you feel like you have to go all the time; urgency, that immediate, intense need to go; and dysuria, which is just the medical term for painful urination. Anyone who's had one knows this combo can completely ruin your week. You've probably heard that women get UTIs way more often than men. And this slide shows you exactly why. It really just comes down to basic anatomy. Women have a shorter urethra, which means bacteria have a much shorter trip to make it to the bladder. On top of that, the urethra is closer to the anus, which is a major source of E. coli. The bottom line? Women are about 30 times more likely to get a UTI than men. It's a huge difference.
The good news is a lot of UTIs are actually preventable. Number one tip, stay hydrated. Drinking plenty of fluids literally helps flush bacteria out before an infection can even start. Simple hygiene, like wiping from front to back, is also absolutely crucial. It's also a smart idea to avoid things that can cause irritation, choose breathable cotton underwear, and make it a habit to pee before and after sex to clear out the urethra. So we've covered the what, the why, and the how for both of these conditions. But honestly, none of that information matters without taking this one single, most important step. And this right here gets to the absolute heart of the problem. People suffer in silence, they're embarrassed, and the stigma keeps them from asking for help. I mean, that statistic for men is just staggering. Only 1 in 5 will even bring it up with their doctor. We have effective treatments, but they can't help anyone if no one knows there's a problem to begin with. And that silence is the real tragedy here. Because look at this number, 80%. That's the percentage of incontinence cases that can be cured or at least significantly improved with treatment. Just let that sink in for a second. Relief isn't just possible. For 4 out of 5 people, it's probable. The barrier isn't a lack of medical solutions. It's a lack of conversation. So it all comes down to this. The cure simply cannot begin without a conversation. Whether it's for you or for someone you love, breaking that silence is the first and most powerful step you can take toward getting back control and comfort. So isn't it time we all started talking?